Good morning, doctor. Can you please introduce yourself?
I'm Savoldelli. I'm oral and maxillo-faciale in Nice, France. I work in Universitaire head and neck surgery Institut, and I'm associate professor in the Universitaire School of Medicine of Nice.
How long have you been using mectron PIEZOSURGERY for?
I tried for the first time the PIEZOSURGERY in 2009, and I have gradually used to introduce it in my daily practice in 2013.
What made you change from traditional rotating and lucidating tools to PIEZOSURGERY?
I used for the first time for technical consideration. So I mean my main activity and my main field in oral and maxillofacial surgery is orthodontic surgery. And I have gradually used and increasingly used guide with surgical plane, and surgical guide helped me to have better results. But my conventional tool as the reciprocating saw not be able to perform it. So I've searched for a new tool with a thickness which permits me and to cut the bone and to follow the guide into the groove of the guide, and it's not really easy with conventional tool. So I try it, but I have seen all the advantages fastly of the PIEZOSURGERY.
In details, which procedures are you using for?
Most of bone cutting in oral and maxillofacial surgery, especially in orthodontic surgery, and all procedure in orthodontic, such maxilla osteotomy, all the quadrangular osteotomy of the maxilla for 1 for 2, bilateral sagittal split osteotomy, sliding genoplasty, eye oblique osteotomy, and chin wing genoplasty for the orthodontic surgery. But I used it for distraction osteogenesis when you have bone cutting, orthodontics corticotomies, rhinoplasty, forehead osteotomy for the upper third of face recontouring, and all the procedure to harvest bone for bone graft of the facial skeleton.
Thinking about your patients, which are the main intraoperative and postoperative advantages you have observed for them?
Oh, the main advantages during the intraoperative time, I think, is high accuracy of bone cutting with less bone loss, and that permits to avoid some bone segment contact not really expecting during surgery. And in orthodontic surgery it's very important, because when you move and you displace a skeletal piece, you need to have a good contact between piece, and for the patient and the occlusion of the patient is really important. And post-operative, sure, there is less pain, less swelling in post-operative, and especially for BSSO, better recovery of the lower lip and shine sensibility is very important.
Is there any disadvantage in using PIEZOSURGERY in your opinion?
Most of surgeons, when they try for the first time PIEZOSURGERY, have one criticism, is the speed, and it's slower comparing traditional tools. But when you have maybe in orthodontic surgery 10 patients of learning curve and you master an insert, I think you don't waste a lot of time. Maybe for a procedure of BSSO you waste 10 minutes, but comparing all the advantages than the traditional tools, I prefer use PIEZOSURGERY device.
And how long did you take to master the technology and fully understand how to use the devices?
Not a long learning curve. I think it's difficult to master not the technology but all the inserts, because Mectron developed a lot of different inserts, and I used for each procedure the same insert, and I can master it for orthodontic surgery, 10 patients maybe. It's not very difficult, but you have obviously a learning curve to understand. You don't have to apply high pressure on the bone, and it's very short to learn how we used this device.
Is there anything else you would like to add?
Yes, I'm very glad to use the piezo mectron device, but it's not for only my comfort consideration. That's important, but I really think there is better results for the patient. And it's very wonderful to get a paradigm shift in our daily practice in surgery, but sometimes you must have to be a little bit patient.
Thank you, doctor, for your time.
Thank you.